All right, we'll go ahead and get started today. Thanks for joining our Gallatin County COVID-19 press call. Today we have on the call Lori Christenson, who's the Gallatin City County Health Officer. We have Kallie Kujawa, who's the Bozeman Health COVID-19 Incident Command Lead. And we have Tracy Ellig, who's the Vice President of University Communications for Montana State University. And I will turn it over to Lori.
Great, thank you. Thanks for joining, everyone. Again, my name is Lori Christenson. I'm the health officer for the Gallatin City County Health Department. And I'm going to start off with sharing my screen and our most recent weekly surveillance report. Okay, so we'll start here with our first figure. This figure describes the number of daily cases and the 7-day rolling average of cases per 100,000 residents. Last week, we saw what looked like a bit of a dip in our case numbers. And this week, as you can see, that dip has turned into an increase in the number of cases. About a 28% increase in comparison to from this week to last week. So our 7-day rolling average of daily cases per 100,000 is 80.8 cases. And I think what I really want to stress here, and as we think about this, is that we've seen these dips previously. And as I mentioned last week, we really need to stay vigilant. This virus continues to be present. And it also shows that we have yet to turn the corner in terms of the number of cases that we're seeing in the community. So it continues to be extremely important that we stay vigilant, that we seek testing when we're sick, when we stay home when we're sick, and that we wear a mask when we're in public places. So I just want to reiterate that we are still very much in the middle of a pandemic where we're seeing a high number of cases. So we need to be vigilant. Our percent positivity also increased, about a 26% increase from the 11.3% positivity rate that we saw last week. So we are seeing an increase in cases. And one thing that we're keeping a really close eye on, and we ran some data just recently. And when we looked at Tuesday of last week, or excuse me, Tuesday the 28th, the 7-day average number of tests was 650 tests. That was the 7-day average. This Tuesday, so October 5th, the 7-day average of tests was right around 500. So that's about a 23% decrease. And what that tells us is that these data signal that we may need to be more vigilant about being tested if we're sick. And I just reiterated that earlier before, and that we need to be testing more. So again, this is something we're going to continue to keep an eye on, but seeing this positivity rate increase is also concerning. Moving on to our vaccination status by cases. Again, we continue to see a majority of our cases in the individuals who are not vaccinated. And the same stands for our hospitalizations. We continue to see, and again, the orange bar is not vaccinated, the blue bar is vaccinated. We continue to see our hospitalizations primarily or mostly being in those individuals who are not vaccinated or are unvaccinated. This is, again, our first dose data in terms of individuals who are seeking a first dose. And again, we have our fully vaccinated data set here as well by age group. Right now, Gallatin County, we have 61% of our eligible population who are considered fully vaccinated. I also want to share, these are our school data, and we also looked at the number of cases that we shared with you in our previous press call, our data related to school mask versus no mask data set. And we also updated those data as well. And as of October 1, we continue to see fewer cases among students in schools with a mask requirement versus schools without a mask requirement. So I wanted to share that updated information with all of you as well. And then lastly, we continue to experience high transmission, and really the number of cases that we've seen in the last 7 days per 100,000 is 5 times higher than that CDC threshold that marks this high transmission. So again, we continue to experience high transmission in this community at a rate of about 5 times higher than this CDC threshold. I'm going to stop sharing my screen. I'll let Kallie speak a little bit to the hospital information that she'd like to share, but I'd also like to just quickly talk about some upcoming opportunities that we're going to be offering here starting this Saturday. This Saturday, we are opening a free antigen testing site at the Gallatin City County Fairgrounds. We have information up on our website, and I'm going to actually ask Kallie if she can kind of work us through how people can find that information as I speak to the opportunity a little bit. So this is our Gallatin City County Health Department website, and you can quickly find testing locations. And the testing location that we're opening, I just want to stress, we have amazing partners that are continuing to do testing throughout our community. And this opportunity really is meant to complement and support those testing sites as well. So you can find all the testing information across the different locations here in our county on our website. And we have a new spot on our website where we're talking, where I want to share a little bit more information about our free antigen testing site. So we are starting Saturday, October 8th. That is tomorrow, rain or shine or snow. And we will be at the fairgrounds. The best way is to enter off the Tamarack and Bozeman entrance. We have a trailer that's set up right basically across from that search and rescue building. And you'll be able to, if you can download an app prior to arriving, that makes the process a lot smoother. If not, we'll have paper forms available as well. And it is, again, it's a free antigen testing site where that turnaround time, we're expecting anywhere between 15 to 20 minutes for an individual to go through that entire process, because that test takes about 15 minutes to fully process. So I just wanted to share that opportunity with the community. That's for individuals who are symptomatic or have a known exposure. The information is on our website, and I'd really encourage, especially the media partners that are in here today, to share that as well as all the information about the different testing locations that are available throughout the county, whether they be at any of the urgent cares, at MSU, Bozeman Health locations, just really making sure people have that information so that they can quickly and easily be tested when they're sick is going to be really critical here. So with that, I'm going to turn it over to Kallie to provide Bozeman Health update.
Great. Thank you so much, Lori. We really appreciate the partnership and opening up additional testing locations. And I did put in the chat there, but I wanted everyone to also be aware that Bozeman Health continues to provide antigen testing as well as PCR testing, but specifically speaking to the antigen testing, individuals who are in those categories that Lori shared so well can show up to an outpatient lab location at Bozeman Health and request one of those tests. All right, but I will give you an update on the current situation throughout our entire health system. Today, we currently have 23 COVID-19 positive patients at Deaconess Hospital. We have 1 COVID-19 positive patient at Big Sky Medical Center. Our critical care unit at Deaconess Hospital has 20 beds and is currently at 95% capacity. 8 of the 19 patients in the critical care unit are COVID-19 positive, with the remainder being other healthcare needs. In the month of September, all of the critically ill patients who were COVID positive that required mechanical ventilation support were unvaccinated. This information is in alignment with the latest science that proves that COVID-19 vaccines prevent severe illness. Additionally, our medical unit is at 82% capacity with 13 of 32 patients being COVID positive. Our surgical unit is at 125% capacity, with a significant amount of those patients on the surgical unit being medical unit overflow patients who are COVID-19 negative. While we are still having very high numbers of hospitalized COVID-19 patients, we remain providing normal standards of care. I do want to remind the community that no visitors are currently allowed at Bozeman Health care sites, except in the following situations. One visitor is allowed for a patient facing end of life. A visitor is allowed for a pediatric patient. Actually, 2 visitors are allowed for pediatric patients. A patient in a behavioral situation or needing emotional support is allowed 1 visitor. And a visitor is allowed to accompany a patient for an obstetric admission or for an obstetric ultrasound. Any allowed visitors are required to wear face masks or face covering at all times when they are inside Bozeman Health Hospital or care sites. Visitors that are permitted at a Bozeman Health care site will be required to go through an entrance screening and asked to thoroughly wash their hands or use alcohol sanitizer before and after leaving a patient room, exam room, or any other healthcare location. Bozeman Health's patient care philosophy remains the same. We recognize the many benefits of engaging families and friends in the healing process. So to facilitate that engagement, we are encouraging family and friends to communicate with their loved ones when they are at one of our care sites or in one of our hospitals, to engage and communicate with them via telephone or using a virtual communications method such as FaceTime or Zoom when available. Please know that it is our honor to care for every patient that needs medical attention, and we appreciate everyone following these measures to help keep our staff and our patients safe. Booster clinics for individuals who have completed their Pfizer-BioNTech COVID-19 vaccine series will continue as a partnership between Bozeman Health and Gallatin City County Health Department. And that will be at the Deaconess Hospital location at entrance 1 from 7:30 until 3 o'clock next week, Monday through Thursday. Patients of Bozeman Health can also request to receive their booster through their primary care provider's office. I'd like to thank our community members and partners for their show of support for our healthcare workers over the past few weeks. I've noticed such a difference when I'm amongst my colleagues out rounding on the clinical units, and I know based on what all of them have said that it is greatly appreciated, and I can see the difference that it's making in their resiliency and the morale of all of them. We also know that our community partners continue to feel the effects of the pandemic, and we want to express our gratitude to Gallatin City County Health Department, all of our first responders, and our other vital services and organizations in the community. We remain committed to supporting all of our community providers despite ongoing constraints related to the pandemic, and we remain extremely grateful for all of the collaborations and partnerships that we have. Thanks to all of you as well for your support and for helping us get much needed messages out to our community. But that's really all that I have for today, and I am more than happy to answer questions.
Tracy, any updates?
No updates from MSU. We still are requiring students, faculty, and staff to wear masks in all our indoor facilities, and we're seeing great cooperation with that across all those populations. Thank you.
Great, thank you. I would also add, and Kallie did a beautiful job explaining the location and the collaboration between our health department and Bozeman Health and getting those boosters out. I also want to just reiterate that those are also available for anybody eligible for vaccine at this time for a first or second dose as well. So please, if it's Pfizer that you're seeking, those clinics are also available for you to complete or begin your primary series. And there also are a number of other locations listed on the Healthy Gallatin website where you can also receive vaccines as well. And we're continuing to add new sites every week. So stay tuned, and please, again, echoing what Kallie had shared too, our media partners have been exceptionally helpful in getting this information out to our community. So I'd ask that we continue to do that so folks know where they can get their vaccinations. It continues to be an important message to share to the community. So with that, I'll go ahead and open it up to questions from all of you.
Hey guys, Kallie, I was wondering if you guys have had to use the surge unit at all. It's been a couple of weeks. Just curious.
Yeah, really good question. We have not had to use our surge care unit up until this point. We have instead been using something called overflow, where we are shifting patients into typical hospital rooms, but it might not be the typical unit that they would normally be admitted to. So I shared with you that we have put medical floor patients who are COVID negative on our surgical unit, and we are maximizing our ability to use negative pressure for progressive or transitional care patients on our medical and surgical locations so that we can maximize the use of our critical care unit. So we're doing some load balancing overall throughout the whole hospital, but we are not using a contingency type of unit, which would be that surge care unit that we've been talking about.
Ms. Christenson, Ed O'Brien at Montana Public Radio, losing my voice here, I'm sorry. This is a little far afield, but we are entering into flu shot season. I wonder, for those who are a little confused, how will a flu shot interact with a COVID shot or a booster? Does one cancel the other out? You know, these concerns that maybe somebody has or just doesn't understand. Do you have any advice, any thoughts there?
I might actually see if Kallie can help me answer that question. Kallie, can you speak to that a little bit?
Yeah, I think it's a good question. And I was just actually answering this question for my neighbor last night. But what we have found in all of the various sources of evidence that we read frequently is that in one particular study that it mentioned that it's completely safe for individuals to receive the flu shot when they're receiving their second dose of COVID-19 vaccine. So in the study that they did, where individuals received their second dose as well as their flu vaccine, there was no worries or issues with that. It was deemed as being definitely safe.
Outside of that 2-week zone then, after the second shot?
Nope, at the same time as the second shot. Individuals were given their influenza vaccine and their COVID-19 vaccine at the same time. And that study found that it was both effective and safe.
Super, good to know. What kind of flu season are you all expecting this year? Or is it going to be weird like last year?
Kallie, I'll try and I'll try and answer that. I think, you know, when we think about what we saw last year, there was a lot of non-pharmaceutical interventions in place. People were wearing masks indoors. it was a requirement to wear a mask indoors in many settings, in all settings in Gallatin County for a period of time. And we also had social distancing. And a lot of our large events were not occurring. So it'll be interesting to see what this flu season will bring if we're not continuing to see some of those same non-pharmaceutical interventions for respiratory illnesses. And Kallie, I'd welcome you to add anything to that as well.
Yeah, we've seen an increase this year over last year in respiratory related illness visits in general. Not all of those are COVID related. So I think we're all monitoring that very closely and are very curious as to the answer to your question as well. But we're a bit concerned about that, seeing the amount of respiratory related provider visits that we're having right now.
Respiratory related, and I'll shut up, I promise. Respiratory related meaning what? Like what examples?
Yeah, anyone who has a concern about their respiratory status. And the reason I use that term respiratory related illness is because not all of them are COVID-19 we're finding. So we're finding other types of illness in the community besides COVID-19 that is causing respiratory illness. Parainfluenza and other types of viruses besides COVID-19. Things much earlier this year than we typically see and from what we saw last year.
Super interesting. Thank you very much.
Mm-hmm.
This is Holly Michaels with Lee Newspapers. I was wondering, Kallie, our reporter in Missoula was saying today that their National Guard that's helping the county there has had their term extended. I'm wondering if the Guard members that are helping out at Bozeman, is there any sort of time limit on them? And has that been extended for you guys? Or I guess, what does that look like?
Yeah, we did just request another extension or an extension from our initial request for the National Guard. So we are confident that that will be granted so that we can continue to use them in the next few weeks. They give us 2 or 3 weeks at a time, and then we reevaluate and ask for extensions. We want to keep those additional resources around because they really help us. They're really helping us not only from a vaccine administration perspective, which we anticipate another rush with a potential approval by the FDA for the younger crowd to receive the COVID-19 vaccine. So that was one reason to request an extension. But what they're doing for us right now is they're turning over beds. They're in our ER, they're in our hospital, they're everywhere, and they're doing deep cleans, and they are helping our environmental services really get those rooms ready for the next patient. So we did, because they are so crucial and helpful for our success, we did request for an extension as well.
Awesome. And then one more question I had, I was reading, and this was maybe 2 or 3 weeks ago, reporting from Kalispell. They were talking about their kind of temporary space they had built to handle surges for COVID cases. And it referenced they had equipment there that was pulled back when the state ended its state of emergency. And I'm wondering if that's something that's happened to other hospitals, if Bozeman Health has experienced any changes that happened when the state of emergency ended in terms of additional COVID capacity you'd built up.
Yes, so we had been in discussions with the state level disaster and emergency services to do exactly what Kalispell did and what Billings did in getting supplies and pursuing opening more of a post-acute care unit. So when patients do not require the hospital level of care, they require a skilled nursing facility or some sort of post-acute care facility for their safety and well-being. That was what we were partnering with DES on opening. And it's my understanding that some of the other areas were partnering from that perspective as well. We didn't stand that up, and we didn't have those supplies ready to go here per se. But I think that as a state, we had to discuss what the best options were. And, as far as current conversations, I think that would have to be directed towards DES at the state level.
Okay, thank you.
Mhm.
I had one quick question. My name is Edgar Cedillo with KBZK. Has the county seen an increase in demand for first-time vaccinations?
Yeah, thank you. So that is something that we are tracking and monitoring. And we did see an increase. I don't have those data in front of me specifically, but we were seeing about 1% increase in each of the age groups, some of our prior weeks, but we have seen a little bit of a decline in that first, the uptake in that first dose in the last few weeks. If I have more specific data to share, I'll certainly pass it along to you. But I think the takeaway message is that we have seen individuals continue to seek a first dose vaccine, as well as complete their primary series with their second dose. So we would urge the community to continue to vaccinate, whether or not you've received a vaccine yet. Please get your first, second, or your booster dose if you're eligible. Does that help answer your question?
It does, thank you.
Yeah, you're welcome.
Hi, Victor with 406emptysports.com. A question for any of you.
Victor, it's pretty hard to hear you. Can you try again?
What about now?
That's much better, thank you.
Okay. Yeah, I was just curious if there's been any evidence of transmission from, it's still hard to hear.
Victor, we lost you again.
What's going on? I don't know what the deal is. What about now?
It starts off well and then it gets a little bit crackly. So let's keep going and see how it goes.
Okay. Yeah, I just wanted to know if there's been evidence of transmission from sporting events in Gallatin County.
Did anyone catch that? Because otherwise, Victor, you can type it into the chat. That might help.
Any evidence of transmission of COVID through sporting events is what I think he said.
That's right.
Okay, thank you for helping us translate that. Not that we have at this time. We haven't looked deeply into that at this time.
Thank you.
Any other questions?
Yeah, I had one other question about testing capacity. I'm curious, I know you said the county testing would be kind of to support the rest of the testing within the other healthcare providers, but I'm just wondering if we're still seeing, like, what the demand we're seeing, if we're still seeing a lot of, and if you guys are able to keep up with the demand for testing.
Kallie, do you want to speak to Bozeman Health's capacity?
Yeah, so we have been able to keep up with the demand from a PCR testing perspective, which is the one that we monitor so closely. Although we had to, there's a couple different types of there's a lot of different types of PCR testing we do, but when we're speaking just kind of general terms about COVID PCR testing, with our Panther testing, which is the non-rapid PCR test, we are definitely keeping up with demand and are seeing reasonable turnaround times, which is important for us to do to aid in appropriate contact tracing and preventing further spread. But then there's another type of PCR test that's the LIAT, and that one is our rapid PCR testing, which is really, really handy for people when they want immediate results. With the LIAT, which is from the company Roche, we are on allocation, and so we are not getting as many tests for the LIAT, which is the rapid test, we're not getting as many as we are wanting. So we've had to pull back and use our rapid tests in the hospital setting and remove those from the ambulatory setting and the urgent care setting. So I think that's been challenging just from patients wanting to know immediate results, but overall testing, we have the ability to process those in a reasonable time frame. And then, the access to antigen testing, we continue to provide access to antigen testing. Individuals can present to one of our outpatient labs to receive that. And then, as Lori mentioned, increasing access as well through the health department. But we are feeling confident about our supplies for that Panther PCR, which is the non-rapid PCR. We have plenty of supplies to continue with that. The part that causes constraints are the staffing piece of that. So having the appropriate clinical lab scientists to process all of those specimens we're collecting could be the constraint that we would see, but we're not seeing that right now.
Are you guys going to do anything in anticipation of that federal vaccine mandate where you can also get tested week by week for companies with over 100 employees? Are you doing anything to prepare for prospective increase in testing demand?
Yes, we have stockpiled some supplies so that we can be prepared for an additional increase in PCR testing demands. But from a supply perspective, we're not feeling super constrained there. It just has to do with our ability to find the amount of clinical lab scientists that are required to process all of those. And staffing resources remain a huge challenge here and everywhere. Mm-hmm.
Cool, thank you.
Other questions? Well, thank you all again for joining us, and to Kallie and Tracy again for sharing your information. And we appreciate the work that everyone does. And I agree wholeheartedly with Kallie that the partnerships that we're forming and the collaborations, we continue to think through the processes that are going to be most impactful and efficient and effective for our community. And working together, oftentimes we're finding those places where we can collaborate and really make sure we're providing the best services to our community, especially when we're needing to be extremely responsive to a pandemic that continues to surprise us. So I just wanted to once again say thank you to the partners on this call today, all of you included, and I wish you a very safe weekend, and we'll see you next Friday. Thanks, everyone.
Thank you.
Thank you.